subject, be it maxillofacial, be it anything. So we have learned the concepts, and today we'll apply it with the MCQs. Okay. Uh, I would love to have interactive in the MCQs so that everyone can answer them. Okay, and it will be more of an interactive session, and so everyone can answer them. Okay, and it will be more. Let us go with the class ahead. Okay. So the first question is, the following is not a basic principle of AVO for internal fixation. Okay. So as you all know, there is something, an organization known as AOCMF. Okay. So this is an association which gives us the principles of internal fixation, like what are the principles of trauma, and what are the principles of fracture treatment. Okay. So this association commonly gives us what the principles exactly are. Okay. So let us go to the options. First one is anatomic reduction. Second one is stable fixation. Third one is preservation of blood supply. And fourth one is early and active mobilization. And fifth is none of the above. So which of the following is not a basic principle of AVO for internal fixation? Can I have the answers in the chat, please? Anyone? Yes. So we'll wait for a minute for the answers to come out. So let us wait for 1 minute. Let us uh, recoup everything. So, okay, the answer is none of the above. Okay, the answer is none of the above, because see, AO has given principles of internal fixation. Okay, the various principles of internal fixation are anatomic reduction, stable fixation, preservation of blood supply, and early and active mobilization. Okay, these are five principles that were given by AO CMF. Okay, this is an association which gives principles of internal fixation in trauma. It also gives us the principles of how to manage a trauma patient. Okay, so first one is anatomic reduction. Any fracture, be it parasympathesis, angle, condyle fracture, be it a zygoma fracture or an orbital fracture. Okay, any fracture needs alignment. Alignment, I mean, it needs reduction. It means anatomic reduction. Okay, then it needs a stable fixation point. A stable fixation point, I mean, it can be a plate, or it can be a wire, or, or it can be any appliance which helps in fixation of the reduced fracture fragment. Okay, first of all, we are reducing the fracture, right? We are anatomically reducing the fracture. Okay, then we are fixing the fractured fragment in anatomically reduced position. Means we are doing fixation. Fixation we can be doing with wires, we can be doing with screws, or we can be doing with mini plates or micro plates or anything, any other plates. Okay, while doing so, we also has to be very careful to preserve the blood supply. Excessive stripping of the muscles or periosteum may lead to necrosis of bone. Okay, so preservation of blood supply is also an important thing. Okay, and then, so for what purpose we are reducing, fixing, and doing everything? Because we have to preserve the function. Okay, we have to preserve the function, and we have to as early as possible, actually mobilize the patient so that the patient can come back and do its routine functions. So this is what the basic principles of AO were meant for. Okay, I hope everyone got this. Okay, so let us have everyone in the chat now. Okay, whoever is there here, let us have in the chat everyone in the chat box here. The following are guidelines for the internal fixation based on four basic principles. I have already explained: anatomic reduction, stable fixation, it is preservation of blood supply, and early and active immobilization. Okay, so then which principle is used for fixation of linear fractures of mandible? Can I have the answers? I'll wait for maybe 2 minutes. I'll wait for you people. Option A is load bearing fixation. Option B is load sharing fixation. C is both. D is none of the above. Which principle is used for fixation of linear fractures of mandible? Okay. Akhil has answered first today. Anyone? Can anyone else can answer? Akhil has answered it as load sharing fixation. Can I have more answers? I think whoever has followed my last lecture, they can very easily answer. It's all about applying the concepts in the last lecture. Okay, Nazalam has answered it as A, load bearing fixation. Then Muhammad Rashik has answered it as A. There are mixed answers here. We'll wait for some more time for more people to answer. So, where do we use load bearing fixation and where do you use load sharing fixation? Okay, we'll go just a bit ahead. Okay, I'll tell you the answer for this. Okay, now let us see another question, a similar question. Which principle is used for fixation of comminuted fracture of mandible? Now, can I have some answers? Fixation of comminuted fracture of mandible, same options. A, load bearing fixation. B, load sharing fixation. C, both. And D, none of the above. Okay, Akhil told B, load sharing, comminuted fracture of mandible. Okay, and Anup has told A, load bearing fixation. I hope everyone attended the last lecture. You can also log in for the last lecture. It's available in YouTube. Okay, it's not like it won't be available. If you go towards the last lecture, you can understand the concepts really good, and then you can apply it here. So Kalyani has told it as A, yeah, load bearing fixation. Okay, shall we go little ahead? Okay, I'll wait for a minute. Okay, then we'll discuss both concepts. What can be used for a simple linear fracture of the mandible, which type of fixation, and which type of fixation can be used for a comminuted fracture of the mandible. So I'll wait for a minute, then we can go start slowly ahead. Okay, Monica has answered linear fracture as load sharing. Okay, so what about comminuted fracture of mandible? I'll wait for your answer for a while, then we'll go ahead. Yes, load bearing. Okay, yes. So, okay, we'll go a bit ahead. Okay, just have a look at this fracture here, this picture here. It's a comminuted fracture of the mandible. Okay, when there is a comminuted fracture of the mandible, any place, okay, any comminuted fractures, they will have less strength. The bone itself will have less strength. Okay, the bone itself will have less strength, and there is less bony buttressing between the bony fragments. So what will happen, the bones will get crushed in a comminuted fracture. So you need a plate which will bear all the load. You need a person who will bear all the load in that moment, when all the bones are crushed out and there is less bony support, or when there is less bony buttressing in a comminuted mandible fracture. You need a plate, or you need a person, okay, who can bear all the loads. That is called load bearing principle. Okay, imagine there is only a linear fracture of the mandible. Okay, there is no fracture, there is just a linear fracture of the mandible, a straight line fracture. The bone will have enough strength, and it has bony buttressing. Buttressing means abutting of the both ends of the fragments of the mandible, abutment of both ends of fragments of the mandible. Okay, so when it has enough strength, then what principle can we use? We can use something known as load sharing principle. Okay, then we can, there can be a person who can share the load as well, because the bone is strong enough to share the load. Then we can use a load sharing principle. Now come on, I want Muhammad, Naz, Alam, and Akhil, Anoop, Kalyani, Monica, everyone, please answer now. Which principle is used for fixation of linear fractures of mandible? I want everyone to answer, please, in the chat box. Which principle can be used for fixation of linear fractures of the mandible? Okay, Nazalam has answered. Load sharing. I think, yeah, Vinita, yes, good. So, I think this is clear for everyone, right? Vaishnavi, everyone has answered. Great to see everyone interacting and answering the questions as well. Okay, so now it is clear, right, for everyone. Now this principle is clear. Now, which principle is used for fixation of comminuted fractures of mandible? Yes, Nikita, yes. So, okay, which principle is used for fixation of comminuted fracture of mandible? Yes. Okay. So Nazalam, now I think it is clear for you all. Yes, you're right. Right. So everyone is answering right. Yes, Prabhavati. Yes. Yeah. Shailesh has answered. Tanu has answered. Great to see everyone understanding the concepts like right. Okay. We'll go a bit ahead now. Okay. So let us see this. A 16-year-old patient has a large defect of mandible after massive trauma. Which fixation plate can be used to stabilize the residual fragment? So think about, read the options first. First, decode the question. She's a 16-year-old patient with a large defect of mandible and had massive trauma. Which fixation plate can be used to stabilize the remaining fragment of the mandible? Residual fragment is the remaining fragment of the remnant fragment of the mandible. To stabilize the fragment, which plate can be used? Okay. So option A is mini plate, option B is micro plate, Option C is reconstruction plate. Option D is none of the above. Okay, Shailesh, Nikita, Akhil, Vaishnavi. I need more guys to answer. Does everyone agree with those answers? Are there any more answers for this? Anyone else wants to answer something else for this? 16-year-old patient with a large defect of mandible after massive trauma. So, what is a fixation plate that can be used to stabilize a residual fragment? Okay, Vaishnavi has answered it as B microplate. Okay, I'm getting a new perspective now. Okay, I need more answers. I need more people to throw your answers out. Okay, it's good to answer rather than keeping something in your mind and answering it wrong in the exam. It's better to spit the wrong answers now. Okay, let us go little ahead. Okay, we'll discuss about this. Okay, so basically what I told was there is a large defect on the mandible and we need to stabilize the residual fragment. Residual fragment, I mean this is the residual fragment. Okay, the proximal condylar part is the residual fragment. We need to stabilize that. Okay, whenever there is a large defect of the mandible, okay, we need something which bears all the load, because there is no strength in the bone. Already so much bone is missing. Already there is so much bone that was missing. Okay, so we need something which will bear the entire load and give the function to the patient. Okay, example of a load bearing plate is reconstruction plate. Okay, so we can use a reconstruction plate. The answer is reconstruction plate. Okay, so can I have the answer in the chat box? uh, so reconstruction plate works under which principle? Load bearing or load sharing? Reconstruction plate. Okay, Monica has answered. I want more people to answer. Okay, good, great to see everyone answering. Now it's a simple concept, right? A reconstruction plate works on the principle of load bearing principle. Okay. Now, what principle does mini plate work on? What principle does mini plate work on? Yes, a mini plate works on load sharing principle. Okay, now let us have another question here, a new question for you people. Okay, spend some time on this question. This is a very important question, but I've already told you the concept behind this question in the last lecture. I've explained you the concept already. So if anyone would have learned the concept well, they would answer all these questions very easily. Which fixation method is ideal for oblique mandibular fractures? Have your options: A, mini plate, B, microplate, C, locking plate, and D, lag screw. Okay. So I've already told everyone, please, please, please read the question twice and answer it. Okay. Ideal for oblique mandibular fractures. Which fixation method? Is it mini plate? It is microplate, locking plate, or lag screw? Okay, a lot of guys have answered. Nikita, Vinita, your dentist, Shailesh, Vaishnavi. Everyone has answered. I want more people to answer. There's something else to this question. Please read the question twice before answering this. Which fixation method is ideal for oblique mandibular fracture? This is an oblique mandibular fracture. This is not an linear mandibular fracture. Oblique. Manisha has answered lag screw. Prabhavati has answered locking plate. Priyanka has answered again mini plate. So your dentist has told lag screw no. So how many of you agree with Manisha and your dentist? Can it be lag screw? The answer. Okay, enough of discussion. We'll just go a bit ahead. Okay, this is an oblique fracture. And oblique fractures run basically from the buccal to the lingual cortical plates. Okay, it starts from the buccal cortical plates and it will end up in the lingual cortical plate. So, an oblique fracture is something which splits. Okay, like a bilateral sagittal split osteotomy. It somewhat splits the mandible sagittally, an oblique fracture. Okay, like how your BSSO, sorry, osteotomy runs. Yes, Prabhu, it's like screws. Yes. So that is how uh, oblique fracture works. Okay, it's same like your bilateral sagittal split osteotomy um, kind of thing. Okay, so how how do you fix this? So the screw basically runs from the buccal cortical plate and engages the lingual cortical plate. So what is this kind of screw called? Is it monocortical screw or bicortical screw? Can I have the answers? Lag screw is a monocortical screw or bicortical screw? Anyone? Can you answer please? Yes, exactly. Good that everyone answered it right. It goes through the buccal cortex to the lingual cortex, labial cortex to the lingual cortex. Okay, so this is a screw which engages both the cortices because the fracture is running from the buccal to the lingual cortex and it is splitting the mandible sagittally. Okay, so this screw, in turn, what happens is it engages both cortices, so it is a bicortical screw, a lag screw. Okay, I hope everyone got some clarity about lag screw, right? Okay, I'll just go a bit ahead. Which of the following is ideal for fixation of nasoethmoidal fractures? I'll give good 5 minutes for you people to read this question, understand the options, and answer it. Okay, don't be in a hurry to answer these questions. These are all new for you people, and these are all based on the concepts only. Which of the following is ideal for fixation of nasoethmoidal fractures? Option A, mini plates. Option B, micro plates. Option C, locking plates. Option D, reconstruction plate. Okay, I got answers within a minutes only. Okay, your dentist has answered it as microplates. Akhil has answered it as locking plates. Priyanka has answered it as mini plates. Okay, everyone opted for one option. Okay, equally. So anyone has more answers? Anu told it is mini plates. Nikita has microplates. Pravati told mini plates or wide fixation. So your dentist has told I guess it has two options, mini and micro. See, one thing I'll tell you, you have to select the best probable option out of that. It may have two probable options, but you have to select on your exam day the best probable answer for this question. Okay, anyone else wants to add anything? Prabhavati has told mini plates. Okay, I got every answer for this question except recon plate. Everyone gave all the answers for nasoethmoidal fracture or nasoethmoidal complex, which is the ideal plate for fixation. Okay, Kalyani has answered it as mini plates. I'll wait for a minute. I think if anyone wants to change their answers now, you can change your answers as well. Okay, Pravati told us many plates and she has given a reason as well. She is telling because the bone itself is thin in nasoethmoidal region. Okay, Pravati, the bone itself is very thin in nasoethmoidal region. It's true. Okay, so which is the thinnest plates of all these options? Okay, Vaishnavi. Okay, mini plates you have answered. Which is the thinnest plate of all these options given? A, B, C, D are there. No, what are the thinnest plates out of this four options? Which would be the thinnest plate? Can anyone answer? Thinnest means very thin in profile. Which plates are so thin in profile? Nasalam, blocking plates. No. No, no, you're answering everything except the answer. Recon plate is also not the answer. I'm telling the thinnest, very thin in sections. Someone known as MC has answered B. And Nikita Laharia has answered micro. Okay. So good. The thinnest plates out of all these options is micro plates. Okay. Micro. Imagine what is micro. Micro is very thin plates. Okay. So as Prabhavati has told, because the bone itself is thin in nasoethmoidal region, if bone itself is so thin in nasoethmoidal region, for the thin bone, which plate will get suited? Yes, the answer is microplates. Okay, so imagine the nasoethmoidal region here. Okay, it's an intricate complex of bones. There is nasal bone, there is ethmoid bone, there is cribiform plate somewhere, and there is also the lamina papyracea. There is some part of the lacrimal gland hiding out. There is some lacrimal crush there. Okay, so yes, your dentist has told yes, micro will take a little space as the bone is very thin. He has guessed right. Yes, you are right. Okay. So micro plates is something which is not even palpable on your forehead. Okay. Imagine a plate on your nose. You can see the fracture. It is involving the nose, the ethmoid region, nasoethmoidal. So if there is a fracture on your nose, the plate should be very thin, right? It should not be palpated. Okay, put your finger on your nose, on the dorsum of your nose. Can you see how thin the skin is over that? Okay, if you place a plate there, you can easily palpate that plate. So the plate should be very thin. Okay, so that it can't even be palpated. Okay, it should be so thin, it should not even be palpated. Okay, good evening, Rahul. Yes, good evening. So yes, Kalyani. So answer is microplates. The answer is microplate. Do any one of you have any doubts for this question, for this answer? Why not mini plates? Any one of you might ask this doubt. I can tell you because mini plates are so thick for this thin bone, and mini plates will very easily get palpated on the nose for you people. Okay, mini plates will very easily get palpated. Not even locking plates. Even locking plates are very thick. Okay, the only thinnest plate is a micro plate in these regions. Shall I go to the next question, or do you have any doubts for this? I think we have only one more question more, so we can wrap it up after that. Or if you have any doubts, you can also ask me like a questionnaire at the end. We'll have a questionnaire session at the end if you have any doubts. Yes, okay. What is the most common constituent of bioresorbable plate? You have your answers here. A polyglycolic acid, B polylactic acid, C polystyrene, and D none of the above. So I'll wait for some time before we end this. Can I have the answers? There are so many answers coming out. Good, great. I think Rahul has answered A, MC has answered A, Nikita A, Monica has answered A, Nazalam has answered A, Vaishnavi, even Akhil, Anup, Vinita, Kapavati, I think Your dentist. Everyone has answered A, polyglycolic acid. Can anyone answer anything else? Anyone? You will be at least 10,000 ranks ahead if anyone answers something else. The correct one. Because see what happens now, if there are 1,000 people and if 990 people answers a wrong thing, a wrong answer, and if 10 people answers correct, okay, those 10 people will go at least 5,000 ranks before. So it's very easy, okay, to get misled. Okay, these the simplest of the questions are where you go wrong usually in the exam, and it's so heartbreaking. It's like peeling your nail bed only. It is so heartbreaking. It is so painful. Once you come out of exam, you'll realize that, because you'll go wrong at the simplest of questions. You'll be correct at load bearing, load sharing, all concepts you will be right. Okay, but the simplest of things you might go wrong in exams. Okay, I'll wait for some time. I'll try for more answers if I'm getting through. So shall I show you the picture once of bioresorbable plate? Okay, this is how a bioresorbable plate looks like. Okay, so Jivika has answered it as C, polystyrene. Okay, I'll take all the answers. Okay, I'll absorb, I'll engulf all the answers, and I'll spit out the correct answer for you. Please take it. Okay, the correct answer is polylactic acid. Okay, the correct answer is polylactic acid. Okay, remember everyone, the composition or constitution of biodegradable plate is polylactic acid. Okay, remember everyone. And where do we use a biodegradable plate as such? Can I have some answers? Where do we use a biodegradable plate? Anything? Any answers? Can I have some indications? Can anyone type some indications where we can use a biodegradable plate? That can be a potential question for you in the exam. Biodegradable plates. Where can we use them? Symphysis fracture, Rahul has told your dentist fixation of bone, right? Fixation of bone only will fix bone only with biodegradable plates, not soft tissue. I want more specific answers. Anything where we can use biodegradable plates where we want the plate to get absorbed by itself. You all know what a biodegradable plate is, right? The plate will get absorbed by itself. Okay, it will stay as long as the fracture is healing, around 4 months or like that, then it will get absorbed. Okay, so where do we need such kind of plates? Osteoradionecrotic, no. Osteosynthesis, probably. Orthodontic surgery, areas where hardware removal is tough. Anup Mahajan has he has come a bit close to the answer. Good. Anyone else? Your dentist in TMJ fracture. Okay, I'll tell you the indications. Come on. Okay, let's come to the facts now. Okay, the basic use of these biodegradable fractures, okay, is especially in pediatric patients or in children. Okay, where do you don't want a hardware to be remaining for their life, or it may be causing retardation of the growth of the mandible or maxilla, as many say in the literature. Okay, so you want in the children something which gets absorbed by itself very fast. Okay, and something which don't need a second surgery for removal of the plate. Okay, usually when we place a titanium plate, okay, many times we'll do a second surgery for the removal of the plate for children. Okay, in such cases we can use a biodegradable plate. And in other cases where biodegradable plates were used is in adults as well. In symphysis fracture of the mandible they were using biodegradable plates. Okay, they started using biodegradable plates, but not so wide and not so often they are using these biodegradable plates. Most commonly it can be used in children. It can be used in children really well, these biodegradable plates, and it is made of polylactic acid. Okay, I hope everyone is clear with this. Okay, you can ask me if there are any doubts. Any doubts, you can put a question for me here. Okay, good. So great having you guys here. Okay, so Prabhavati has asked me, sir, is it not used in orthognathic surgery, sir? See, there are some literatures where it might be used for orthognathic surgery, but it is not time tested and time proven as it. Okay. Name of fracture in pediatric. Rahul, any fractures in pediatric, Rahul, you can use for mandible fracture, orbit fracture as well, zygoma fracture as well. Okay. When it is indicated, you can used. Okay. Vinita is asking me, sir, is the previous lecture on concepts available in YouTube? Um, I hope so, Vinita, but I think you have to ask Dr. Meghna as well. She's the management who is doing of this management part of this crown edge and all. And as I've told you, see, Vinita, there's one thing what I follow in my lectures is I prefer to give concepts in my first lecture really well and then keep the MCQs. Okay, people always tell in entrance exams that you need MCQs to crack an entrance exam. It is not right. Okay, because if you have your concepts right, you can answer any type of MCQ. Okay, if you read 1 crore MCQs, or if you search the Milky Way and galaxy also and scratch all the MCQs and read everything, okay, they can get an MCQ from Mars or Venus and give another MCQ for you in the exam. Okay, that is literally not possible at all. You need to learn concepts well and apply those concepts in the exam when an MCQ comes. Isn't it right? Okay, I want everyone of you to change that attitude in yourself. Okay, so that uh, you can crack your exams. Okay, so Nikita has asked a very good question. Nikita Laharia, disadvantages of bioresorbable plates. Nikita, the disadvantage of bioresorbable plate is, this is especially a very good question. There is bioreactivity. Okay, there is reactivity, okay, or allergy in some patients, okay, in bioresorbable plates. Okay, they have noticed in some patients there are some cases of allergy is seen, and some cases of reactivity is seen. Okay, we need something which is bio friendly, right? We need something which is not causing any allergic reactions. A good question. Anup Merjan has asked, sir, ideal landmark to look for zygoma and Jademsi fractures. Okay, Anup, the ideal landmark to look for in Jademsian fractures and zygoma is your buttress. The buttress is the most important landmark, and it is also known as key ridge. I'm giving you an MCQ answer here. Okay, key ridge in Jademsi fractures is the buttress. Okay, because that is the main strength bearing area. It has so much of immense strength, Anup, the buttress region. So that is the main landmark. And it's very good to see many of you asking trauma questions. Actually, I'm not dealing with the trauma much now because in the previous Crown Edge app, I have given a series of lectures. I think around 10 to 15 series of lectures, around 18 hours lectures. There, those are on trauma. Okay, they have several parts. Like only trauma, I've given 8 lectures around. It's each of 1.5 to 2 hours lectures. After that, it's been 1.5 year. I haven't much given lectures for you on trauma. But if you guys want lectures on trauma, I can definitely make some lectures on trauma. So then your dentist to build a concept takes a lot of time rather than reading simply MC, but I personally feel like going very slow by reading in depth kindly allow. Sure, sure. See, you can read an MCQ and make a concept out of that. Then you can also read parallelly different things after reading that MCQ. Like you have to read 10 variations of that MCQ and go through 10 concepts. Even that helps for you. Okay. Uh, but simply reading an MCQ doesn't work. Okay. I hope I'm clear for everyone. It's been a great evening, and I have a great crowd here, great aspirants here. Good to see you all. It's like I think at least 90% of you will definitely crack these exams. You guys are fantastic. Okay, so thank you so much. Okay, thank you. Have a great weekend as well. Okay, work hard and let the luck and God's grace follows you. Okay, bye. Thank you.